Americans opposed to the health care reform bill about to be voted on in the House of Representatives have been loud, but do they really represent the majority of Americans? Joining me now is one lawmaker who says, no, they don't. Congressman Joe Sestak, welcome to you. You represent the 7th District here, and you are voting how tomorrow?
I'm going to be very supportive of this bill. This is actually the reason I got in 3 years ago to Congress, and I ran on the elements of this bill.
Now, how come you weren't in Washington today twisting arms?
I was very much in Washington. I just drove up for an event tonight after votes. No, I was right down there, and I walked outside past those who were there for the Tea Parties, and I shook a few hands along the way. They weren't happy. But I understand some of this very much. I don't understand some of the epithets that were thrown out there, but I do understand that health care is one of the most personal public policies there is. And there is understandably a great debate over this. But at the end of the day tomorrow when we vote, millions of Americans are going to have health coverage, didn't have it before. We're going to remove the insurance companies from being between the doctor and the patient. And we are going to strengthen Medicare and also reduce the debt. This is good for my district.
But do you have 216 votes right now for sure?
As I left today to drive up here, and after tonight I'm driving right back down, we were between 214 and 221, wavering back and forth. Some of the members say I'm leaning this way and coming back. But I have no doubt tomorrow, at about 5 or 6 o'clock tomorrow night, 216 individuals, if not more, will be voting for what's good for Americans overall.
Now, Congressman John Adler, a Democrat representing New Jersey, the 3rd District there, appeared on Good Day yesterday, and he explained why he's got to vote no. Listen.
We certainly need health care reform, but I'm not convinced that the bill that's going to come before the House on Sunday does nearly enough to control these alarming increases in premiums that families and businesses are facing over the last several years. If we don't bend this cost curve and make it more affordable for businesses, we're really going to hurt families and our middle-class economies. We really should be doing a lot better than what this bill will allow us to accomplish.
Now, is he right? Early on, you expressed some of the same concerns that he had at some of those town halls.
I have great respect for John. However, he voted against the House bill, which actually the Congressional Budget Office said in the next 6 years would reduce health premiums by 25%. No, this bill may not be quite as good as that, but understand that small businesses, where the majority of Pennsylvanians work, are paying 20% more for their health coverage today, because in a company of 20 people, if one person has cancer and you go up to a large insurance company, they're going to charge you more. Today, in the bill we're going to pass tomorrow, you can take those 20 people and put them in a statewide pool of hundreds of thousands of individuals, like a big corporation can do, and therefore small businesses where the majority of Pennsylvanians work will have their health care cost by about 20% if you work at a small business.
But Republicans say it's going to be a burden on them, it's going to cost too much, and Americans can't afford it.
Well, you know, this is very interesting. This comes from Republicans who tripled our debt from $4.5 trillion to $11 trillion. And in fact, this reduces our debt by $1.2 trillion. But understand, Joyce, today, that if you personally have health coverage in a family of 4, you pay $1,100 more today to cover those who don't have health insurance, because when they get very ill, they go to the emergency room. The hospital doesn't eat it. They pass it to the insurance company that passes it on to those they cover. So what we're doing is reducing the debt by bringing them in and actually giving preventive care so that if you have an illness, you catch it quickly and it costs us less over time.
Were any of your colleagues or the president able to change Congressman Adler's mind?
No, but I can respect his difference of opinion. But if you walk through the facts, and then you sit back here in Pennsylvania and know that today, as we go to bed tonight, 700 Pennsylvanians lost their health coverage and 700 more tomorrow. Those who have private health coverage are those that should most want this bill, because it begins to decrease cost. Is this much as the House bill originally had? No. But that's why this is a first significant step. And you know, my daughter, she had brain cancer. When she's 18, she could not get health coverage because of a pre-existing condition. She's 8 today, going on 22, but when she's really 18, now she and anyone else who has a pre-existing condition can be covered.
You've got a lot of people, a lot of colleagues, and some of your Democrats who say that is not what we need right now. But we're going to hear much more about this, and we'll be checking in with you tomorrow. Thank you so much, Congressman Sestak, for coming in with us tonight.